bleeding. Sana mekan no impempi no unhu moja ewo utie fima aya uyem timi show ukọ hospital na se unhu ye bia uka se omo test ye test bia ye ebu ha unhu moja no kra wo fie ba obedu bia hospital na ye ka se bia for sebe utie fi bra na ye hwehwɛ mu na mo hu ne me bia omotimi hu moja umfa wo wanka se wani ehu eno so ewo ho ena ye beka hu so asem ba moja yankasankasa ye di ye ni hu se bi uja onan awana so ko toilet na wankasa hu se moja ewo ma in fact oyam ehyew unhu bebia efi ena unnim de ntia aba na enne adesuen ebema ye hu why etimi sometimes no yetimi enya blood in the stool. It is an kind of blood in the stool can be frightening. Whether you discover it while wiping, now or wipe who say I will wipe num, I will tea ronum, so on, and also I will honoma, say, aya a pa na and bohu ekra and no betiniama, I say. But sometimes, it could be a signal of serious problem. Blood in the stool, but sometimes it's not a serious problem at all. It doesn't have to be serious problem at all. It can be just something very, very, very simple. Just ubitimi asolve without even unya home remedies be cra ubitimi ayeden edia asolve and say or panic. Yeah, rectal bleeding is a symptom, and I say a indication of conditions like hemorrhage no you can't piles and now say anal fistures. These anal fistures, an inflammatory bowel disease, IBD, inflammatory bowel disease, and also inflammation bowel syndrome. Ulcers, and now say colorectal cancers and so bit me aba. But ye koswa mecheche any name na ntiasie aba. Until when you spot blood and as blood, toilet paper ma as you wipe you wipe after sebi uja unewi there are actually different colors. So blood in the say red, but you red red. You were different colors a chere baby efi awo sebi uyemono anase unipeduenum yehwe blood na yenchere the indications baby blood na etimi efi se unhu bright red bladder bladder very bright now bleeding anase moja efi your column no ene your large intestines ene baby sebi I not toilet ni ebegu answer na sebi aba out and now say ebe bladder if you rectum no and also another part and the last part after column no and the last and a twice no was sebi otonom ankasa and even rectum no into so unya bright red blood now and no chere say blood no if you column no and now say your rectum area say unya unhu dark red blood na and I friend moron blood na it means say bleeding no higher in the column that is in your large bowels and I say bit me higher in the small intestines. So yen srung think na friend small intestines and other small bowels and no say muja no efi ho eba that is dark red blood and I say moron blood no. Now you another type of color and also a friend melena no dark I say coal tar a dark tar like stew bones sebi uja na toilet no I say coal tar I very dark and no and also so say set kind of bleeding from the stomach uyamna ankasa a bit ma say when you ulcer inti enu so ewo the black smelly tarry sticky stool and if is called melena no inti ano mutuni di hospital mutuni di melena inti eno no I say tarry sticky and smelly sabi toilet no eno no echere say bia ulcer uyam ayekro ena blood nankasa efimu eba sometimes say sa toilet no announce it if exposed to acid na ɛwɔ yam na ɛne na change saa color no na ɛsɛ nipa no uhu saa color no nti normally no ayɛ sɛbi ɛwɔ nka paa ɛno na ɛbɛkyerɛ sɛ saa blood no efi wo yam no ankasa sometimes no saa mogya no bacteria enso so betime change saa color no enso yɛkɔ so nso a yɛhu sɛ sometimes no rectal bleeding no isn't visible to the naked eye and yet all the time na ubetimi de wani nkosua edi ehu nti no gye we bia wakɔ hospital na yɛka kyerɛ sɛ sɛbifa o toilet no ɛbra o tie fi bra na ɔmo hwehwɛm ebi a yare foforo bi ɛna ebi a ɔmo pɛ sɛ ɔmo hu ɔmo hwehwɛ o toilet ɔmo de microscope ɛde ahwehwɛ o toilet no na mahu sɛ blood no nso so ɛwom wo mfa wani hu ɛnso ɔmo timi hu sɛ blood no ɛwom ɛno nso ɛwɔ hɔ saa this type of blood no yɛfrɛ no occult bleeding no yɛmfa yɛni ankasa ɛnhu nti wobɛka sɛ wankasa woyɛ free but eben ɛno no ɔmo hu a wanhwɛ ya na sɛ ɔmbɛka sɛ possibly no ɛyɛ colorectal cancer and it means cancer of the large intestines no ɛhɔ ɛna ɛfi nti aya blood nti na blood in the stool no ana ɛhu itimi ɛba no because obi bɛdwene sɛ ɛyɛ sei obi bɛdwene sɛ ɛyɛ sei but sɛ na mekan ɛnɛ ɛnsi sɛ mobɔ ɛhu ɛkora because ɛnɛ yɛbɛhu sɛ blood in the stool no there are other reasons not necessarily cancer at all nti jump into saa conclusion no nti na ɛsɛ yɛsua saa adeɛ na yɛsua adeɛ na yɛtumi ɛhu what is really going on na yɛnhwɛ symptoms of rectal bleeding symptoms ben na wahu say that rectal bleeding of course the symptom of rectal bleeding different depending on what is causing the bleeding different now normally no rectal bleeding now you have a feeling of rectal pain rectal no sebe bebia toilet efa na ujaw na efa no ubon se pain ewo ho yaw ewo ho ana pressure ewo ho the second thing no say of course seeing bright red blood blood no in your stool no and now say in your in the underwear and now say toilet paper obi use so and also clear symptoms no having that stool that is red more and black in color no and also very clear into stool no sebi uja nine na utifin dark color na too dark na it means say blood ankasa war stool no mo enti enye not necessarily red color and so sebi the stool no and not if you very dark and having stool that has that cold tar or sticky and then smelly sebi one kapa ukotore na one kan sticky and also so express moja and so war sebi utiefinu mo now after so ye koso a yehu se omo aya omo ja omo nan na blood nso ɛwɔ omo stool no nso no in fact obo ha mfa nani ehu but mentally no obo nso was start it can cause confusion because you are losing blood and now obe feeling lightheaded because of loss of blood ulusu blood up through the stool now ema wo iron enso ekofom na wo iron ekofoma ubon se wanisu etimi echinwo nti se wanisu chinwo now you experience confusion or fainting and now say your cause so ubon say abdominal pain ubon so abdomen we have cramping and now pain and also another experience obetimi enya ewo ho now in some severe cases rectal bleeding can lead to shock. A bit may lead to shock. Lose too much bladder. Too much bladder. A lead to shock. Adentia. Well, yenshe. And no symptoms bang and obenya. Obia wenya a severe rectal bleeding na onya shock no. Obe experiencing a sudden drop in the blood pressure. Ubonse ne blood pressure a bit bafom na afei nso na koma bon 10 na afei nso se nipa no nso no ubonse obe yi ne jonso ontimi not able to urinate ne jonso no entimi emba papa Nothing so no one share, the person can slip into unconsciousness, and then continuous rectal bleeding, it can lead to confusion. Now, need the skin, are you cold? Brofum said, clammy, are you wet? Oh, are you wet? And no, that's the cause of, that's the indication of shock. And no. But you be causes, and then you see, basu see, no causes. Senya wasum ebejo. Said it's blood in the stool, wasum betimi ajo because unim the causes the edina bano. Now before you be causes no, etiefo memfa ye number and tuja. Now enye blood in the stool. Nkwa ene ye ka ho asem anase topica ye be ka ho asem no enye no nkwa ho yare ene ye treaty ewo ye center ho, and that is Natural Link Limited ewo Woolwich Arsenal London enye ho nkwa enye no nkwa ye treaty yare biara so diabetes akoma yare o heart failure o kidney problems o that dialysis so kra hwebra hepatitis fertility problem sexual dysfunction, arthritis, osteoarthritis, or brain disorders, Parkinson, Alzheimer's, chronic diseases, and no pa ye young juma papa. And na sebiana yaresa, aresa biansono, omuntimi and young jumba oba as your honma, ye juma pa into oba, nyambitimi, afire so na wetimi abwa. Ye koswa, ye fat number intuja, 0738 464 7300. Now maybe 0738 464 7300. Say be offer outside the UK so of course not the +44 no at the account not the 738 464 no 7300 atwaso. Second number no +44 745 988 9152. Now maybe +44 745 988 9152. Inti way any number no ubitimi afre ebi after the show and say be ochina ubitimi afre say oh any problem like this now blood in the stool and I say oh any other health concerns ubitimi so afre na yeti nyame ubitimi afai so etimi di aboa na yenhwe na what causes rectal bleeding the edena rectal bleeding ankasa eba. Now, causes of rectal bleeding, the rectal bleeding, I say, moja, etimi ba sebi utie fimono, a range from mild to serious factors. A bit to me, first one, you mild causes no answer. They are serious ones, and so mild causes no, associated with that is which is associated with rectal bleeding, include this one. Number one. I mild do not any serious cause and a serious reason. Ye free be anal fixture. Ye ka anal fixture now. A small tears. Ubon se sebi in your anus no baby sebi uja na fano. There will be a tear. Ubon so honomono and when and ye friend anal fixtures no. And no the crack in the skin no causes severe pain. And some bright bright red bleeding and so aba if anal fixtures just say the tear in the anal side in the rectum area no and no it the very bright red blood no it at the back sebe authority mo your cause so the and also so idea mad and yet very serious factor no serious constipation obuha untimi jane na hwe enipa udidi wia between 6 to 24 hours no aduane bia wadi bia no ese sa aduane no ese etimi ba out unipa aduane eyi sa aduane ma hoden wia de ebeka no ese etimi ba out between 6 and 24 hours. So wentimi enja wonanya ana wentimi anko toilet who say a very unhealthy. Normally no set stool no ana toilet no echo pile up your large bowels no into bo ha stool bit ma pile up I want rectum honum 6 months na embaye but ɛno no na ayɛ ɛtumi de column cancers ɛtumi de ba but saa nipa no nyɛ sɛ bia ɔnkɔ toilet 6 months so but ɔntumi gya ne nan ɛyɛ obi wɔ ha ɔbɛtumi gya ne nan ebia 2 days 3 days ɔbɛfa afasiduro na ebia toilet a ɔbɛkɔ no na ɛhwie na ɛma ne yɛm ɛhwie na ɔyɛ mu hwie nso a healthy bacteria na ɛwɔ wo column na wo large bowels no ɛku healthy bacteria no ɛyɛ very important for your brain health and very important for your immune system nti obi wɔ ha ɔntumi ɛnkɔ toilet nti no na wakɔfa afasiduro anaa ɔfa duro bi a ɛbɛhwie ne yam ɛnso na old toilet no nso no ɛwɔ ne large bowels no a ɛsie no afasiduro no ntumi ɛnyi ne ɛmfi hɔ nti na still na ɛwɔ hɔ nti constipation anaasɛ passing hard stool obi wɔ ha sɛbi ɔba akɔtena toilet so no ɛyɛ den ma no ɔbɛkyema na ɛba ɛno no set kind of a condition no ɛno nso so ɛtumi ɛde blood in the stool no anaasɛ ɛtumi de mogya ɛso ɛtumi ɛde ba wo stool mu another condition ɛno nso so no ɛnyɛ too serious ɛbɛtumi de blood aba wo stool mu no ɛyɛ condition yɛfrɛ no angiodysplasia no ɛyɛ den ɛyɛ simple ɛyɛ condition a ɛkyɛ sɛ o blood vessels no it lead to blood vessels no around the bowel area hɔ no baabi a sɛbi rectum hɔ no o blood vessels no ayɛ weak nti ayɛ weak no nti no ebi tumi pae because o blood vessels no veins na ɛwɔ hɔ no mogya nkoa ɛna wɔm nti sɛbi saa condition angiodysplasia no etumi ɛba na sɛbi ugya nan a na mogya nso ɛwɔm ɛno nso ɛwɔ hɔ then yɛfrɛ condition a ɛyɛ hemorrhage anaasɛ cancer hemorrhage na ɛno no na ayɛ na yɛfrɛ no piles no koko nti koko no ɛdɛn ɛna ɛyɛ koko koraa koko no ɛyɛ veins no yɛ baabi a sɛbi yɛgya yɛn nan fa no na rectum no and normally no yɛwɔ a lot of veins ɛwɔ hɔ veins dɔso paa wɔ hɔ nti sɛbi ɔhɔnom no ebia wogya wo nan na wontumi ngya wo nan yi anaa ɔhɔnom yɛ inflame a wonya inflammation a wobɛhu sɛ saa veins no na ebi apae na mogya ɛwɔ mu no na ayɛ den aba wayi mu o toilet mu ɛno nso ɛwɔ hɔ a ɛfɛ no hemorrhage anaa piles nti piles no na aseɛ no ɛno nso yɛ one of the causes na the next point ɛyɛ polyps and now small tissue growths in the lining of the rectum and our column. Bones in Yaman Nkitibi, eyes and pompon Nkitibi, etimi enyini, the small in your column, bebia sebi, or toilet ankasebi gu answer na abano, bones small growths, etimi bao, a polyps, and a small tissue growths in the lining of the rectum, bebia sebi uja nafa, and now the column no, so and also no, through that and also no, ubetimi enya. Moja epa and so bitimi aba. Any your work condition a feno diverticular disease. Diverticular disease, normally no your funum no column no baby toilet egu ansana a PF in a column no large bowels no you able to small patches be that project from the column and so column wall no say ye funum ewo anu so wɔ no wall so ɛwɔ no wall na aya na projections bi ɛwɔ hɔ a yɛfrɛ no diverticular ɛno no saa diverticular disease ɛno so ba ɛno so timi pai na ama mogya nso ɛba stool no mu na yɛmbra more serious reasons a ana factors a wobɛtumi a wobɛhu blood ɛwɔ stool mu anaasɛ bi otiefi mu ɛno no yɛfrɛ no anal cancer anaasɛ colon cancer baby a toilet na nkasa gu no cancer timi ɛba hɔ sɛbi ɔmo ntimi gya ɔmo na ɛyi na ebi a ɔmo ntimi nya constipation toatoa so no obi wɔ ha 3-4-5 days not on call toilet and obi ɔbɛhwe nam ebi especially red meat no wisa kra nwisa nti normally red meat nti yɛsɛ red meat no ɛho wɔ nsunsuanso no ɛtumi ba kɔhyɛ wo column hɔ a ɛbɛyɛ 6 months na empie yɛ wo deɛ w'anum no wawisa o ɛnso no ɛkɔ wo yam no ntumi a work on well because in fact red meat idea ɛyɛ difficult to break down. Nti you won't say afa o system na akɔ o column na akɔ sie wɔ hɔ. Ebetime sie wɔ hɔ na apro. Nti ɛpro na bacteria nso so ɛkɔ ka ho a ɔmama ne pro na afei sɛbe mogya ɛwɔ hɔ no fi no ɛtumi create column cancers. Actually, in fact, ɛne yɛwɔ biribi a yɛfrɛ no inflammatory bowel disease. Inflammatory bowel disease ana yɛfrɛ no IBD anaasɛ inflammatory bowel syndrome no ɛno nso wɔ hɔ. Normally, inflammatory bowel syndrome no ɛyɛ a situation a sɛbe wodi biribi a ɛbɛn sɛ wayɛ sensitive. Ɛbɔ wɔ ha sɛ medi tomatoes a na meyɛ anaasɛ me nom milk na meyɛ ana medi aduane bi specific aduane bi a na meyɛ so woyɛ start ɛyɛ sensitive to some nnuane bi a saa condition no yɛfrɛ no that is inflammatory bowel disease anaasɛ IBD inflammatory bowel syndrome IBS ɛno nso ɛwɔ hɔ the same thing ɛno nso so betumi akɔ so blood in the stool a ɛyɛ quite serious inflammatory bowel syndrome ɛno nso wɔ hɔ ɛne yɛwɔ ɛyɛ condition so a yɛfrɛ no esophageal problem. And no esophageal problem no veins, varicose veins, and veins wo esophagus no, and now food pipe no. So and also there could be a tear in the esophagus that can lead to very serious problems, severe blood loss, and also and so another serious problem a friend of peptic ulcers. Peptic ulcers, an open sore and a kura what the lining of the stomach no uye fumu no the lining bibi a lining a woman and as a duodenum no the upper end of the small intestines no unstrumun nketwa no the upper side no and if any duodenum and also no a hormones no obetimi nya ulcers wo ho and now stomach nankasa no uye funu mankasa no lining no there could be sore ɛwɔ hɔ nti yɛfɛ no ulcers no ekuro nso betumi aba hɔ ɛno nso yɛ quite serious. Many peptic ulcers no are caused by infections and as with infections with bacteria ɛno na ana ɛde saa problems no ɛde ba nti ɛtiefo ɛnɛ yɛsuadeɛ nti yɛmbɔ ne tɔfa ɛnɛ what is the takeaway home and actually today takeaway ne sɛ yɛhu sɛ blood in the stool no enya adia ensi se usuro because it could be a few reasons inti se uhu a ensi se ubohu ebetimi aye very simple reasons and as ebetimi nso aye very serious reasons dia ebetimi aye na ya prevent any mild reasons and not very serious reasons no say you be in general no your digestive system no so ohwe wo digestive system no sebe ensese oyem etim enipa and half nso no very important say ye didi a say ye to ye boase edidi ye see ye to ye boase etimi wesa aduane ne eyi pa very very important say in fact aduane bia ye say drink your food. It means say drink your food no it means otimi ewisa waduane ne eyi pa na owisa waduane ne ya na fit na is nsuo a ansa na sebe 1 minute obi wa ha odidi a in 10 oboboso na no ne sembo boso kakra bi pe na 1 minute no emboa ebasa na untimi nya good digestive system. Now another good advice in so ubetimi nya ohun say to have a good digestive system say udidi a enum nsuo udidi na onum nsuo a se na maka no aduane a udi no untimi yam ne papa ebedi problems edi bebrow udi na be ye dryer o sepu udidi wi a twen don hre ba ko ne fa 1.5 hours answer na wanum nsuo. So I advise you from time to time no me remind them more because that is the way and it's very important to eat more vegetables and 10 minutes to time of eating no monsieur normally 30-40 minutes no more water ebuapa now more vegetables so very important say Africans ye duane no starch nkwa inti say udia starch no manembra form na chese unya more vegetables. This is the way to go. Now this one you will have very a good digestive system. Unya sa problems ebia na se unya moa efa blood in the stool and as a mwafufro bia ubitimi afreme. Say ye jingle better so na ye the English version of the same topic ye de beba after this jingle no pɛ yɛde bɛto aso sisi a nti medam ase sɛ matune in ɛnɛ na yɛsua deɛ medam ase paa na Thursday 8 p.m. no so yɛde fresh topic no so no yɛde bɛbrɛ mo nyame nhyira mo paa ɛneɛ bye bye.
The first development of diseases is in the cell's tissues before they get into the blood, urine, and stool. Diseases do not start in the blood, and so if you are waiting for investigations to be done on your blood sample to know your disease, the results will only be a confirmation of a well-developed disease. Yes, it is only being confirmed. Had I known, it's always at last. That is why we are recommending Dr. James Natural Link. Our facility is well equipped with ultra-modern smart machines to screen and identify all diseases, your well-being, and what is going to happen within 6 months to 1 year in your body. Dr. James is an experienced natural medical practitioner, gerontologist, and a health educator. He graduated from a renowned Canadian institution and practiced in Europe. We offer many natural therapy like detox, pain management, skin problems, weight loss, anti-aging, and many more. We will give advice on dieting for all medical conditions. With over 20 years of experience, Natural Link will help your body cure itself from all diseases such as blood pressure, diabetes, stroke, heart diseases, arthritis, kidney and liver disease, prostate enlargement, asthma, hair loss, and even cancer, and many other diseases. As the saying, seeing is believing. We will, with our ultra-modern smart machines, screen your body to get rid of all hidden diseases. Call us on 073 846 47300 or 074 598 89152. Address 9211 Gunnery Terrace, Village, Arsenal, London, SE18 6SW. Email holisticforall@gmail.com. They say prevention is better than cure, but we say prevention is better than intervention. Dr. James Natural Link,